Research shows that African Americans have the highest death rates from coronavirus in the United States. President Donald Trump joins the coronavirus task force at the White House on Tuesday for a press briefing to discuss the matter.
This is a real problem, and it's showing up very strongly in our data on the African American community, and we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible.
Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Diseases, was also at the briefing on Tuesday to discuss why African Americans may be more vulnerable to complications from the coronavirus.
We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans.
Dr. Fauci explains that existing health complications is what has made the outbreak so much worse in African American communities. But does the disproportionate number of deaths due to the coronavirus outbreak show the significance of racial disparities in the healthcare system?
Good evening. Thanks for joining us. Tonight, even as we begin to see what may be glimpses of a flattening of COVID numbers in parts of the U.S., concern is growing over hotspots like Detroit, New Orleans, and Chicago.
Currently in the state of Michigan, we understand that 33% of the COVID cases are African American. 40% of the deaths are African American, but yet African Americans only make up 14% of Michigan's population. So those numbers are striking. Testing sites, testing opportunities are very limited in inner city communities. Most of these testing opportunities are in suburban areas. Our patients already struggle with transportation, and so you have to either take a bus, find a ride to these testing areas, or walk, and that's just not realistic for our patients.
The demographic data on race and ethnicity of the people who have contracted the virus has not yet been submitted or complete in some states.
Hey y'all, how y'all doing? Everybody staying safe. Too bad we can't shake hands, but we do it like this. Right. We're in a community now that has been disinvested in. We are segregated from opportunity and resource, and then we are become open season when this kind of pandemic sweeps across the country. Nobody can do service now.
Really?
Because of COVID.
Reverend Marshall Hatchnell delivering a message of caution.
That's why people keep on getting these gloves. Okay.
That's what that's all about.
And then the cops keep stopping people, telling them to get 6 feet apart.
Federal healthcare officials are now being mandated to release their racial data in order to ensure that all communities being affected by the outbreak are receiving adequate information, resources, and testing in order to prevent the spread of the virus. This informational gap prevents cities and states from equitably distributing medical resources to those in need affected by the virus. Coronavirus deaths shines a bright light on the unacceptable health disparities of African American communities that will need to be addressed in the future.